Well, doctors, tonight with a major warning. It is so important you pay attention to this. Do not, under any circumstances, try to make your own self-remedies against the coronavirus. One person is now dead. Another person is in critical condition tonight after trying to treat themselves. Our John Treeweiler is joining us live tonight over at Banner University Medical Center. John, what do we know about these people who, or at least this one person who sadly died and the other person in critical condition?
Yeah, Brandon, we know this was a Phoenix couple, a husband and wife in their 60s. We're told that they ingested a chloroquine phosphate, and because of that, as you mentioned, one of them is dead, the other tonight fighting for their life. A harsh warning from Banner Health poison control experts after a senior couple ingested a home product said to be a chloroquine phosphate, an additive commonly used to clean fish tanks.
It's our strong feeling that no one outside of an intensive care unit should be receiving any of these antiviral medications at this point. We just simply don't know which patients will benefit from these medications.
Health experts concerned about this behavior as we deal with the coronavirus pandemic. Dr. Brooks saying self-medicating is no way to deal with this. First responders with the Phoenix Fire Department add making your own medications can be extremely dangerous.
I want to see this happen to anybody, and we want to encourage people to go to reputable sources for your information. That's your doctor, the cdc.gov. Not just any website that purports to have a miracle cure.
According to Banner Health, the couple who ingested the chemical began to feel immediate effects within 30 minutes, requiring them to get emergency medical care.
I know it's incredibly difficult to be patient in our society, especially when things like coronavirus are going on. We want everything to be over within minutes or hours, and that's just not how it's going to play out.
Dr. Brooks adds that medications described as anti-COVID-19 are not recommended for non-hospitalized patients. That includes the anti-malarial drug chloroquine. Now, the Phoenix Fire Department adding tonight that the best thing you can still do is preventative measures like washing your hands and social distancing, things we've talked about. If you're not feeling sick or symptoms, follow those preventative guidelines. If you are starting to feel sick or symptoms, you should seek help from your doctor or local hospital. Do not take matters into your own hands. We're live at Banner UMC tonight. I'm John Treeweiler for Arizona's Family.
John.
The development this morning, an Arizona man has died after he took chloroquine phosphate because he believed that it would protect him from the coronavirus. You may recall the president has been talking about chloroquine in a tablet form, which is a malaria drug, which he believes could in fact help people who are struggling with the coronavirus. We talked to this man's wife, who is now also in the ICU, about how and why he took this particular chloroquine phosphate.
Did you see the president's press conference? Where did you hear about?
Yeah, we saw his press conference. It was on a lot, actually.
And then what? Did you seek out chloroquine?
I had it in the house because I used to have koi fish.
So this particular form of it that he took was used to kill parasites in fish, apparently. As you know, the FDA is looking at whether chloroquine could be used. It's a malaria drug, could be used to help people with coronavirus, but not in a raw form, certainly not in the form that you would use to kill fish parasites.
The hospital system Banner Health reported on Monday that an Arizona man in his 60s died after using chloroquine phosphate in an attempt to self-medicate the coronavirus. His wife also attempted self-medicating and is currently under critical care. Chloroquine is a drug typically used for malaria, but according to Banner Health, it's also an additive commonly used at aquariums to clean fish tanks. President Trump recently called it a possible treatment for coronavirus when combined with azithromycin. Now, we should note the FDA has not approved the drug for coronavirus at this time. And infectious disease expert Dr. Anthony Fauci told CBS on Sunday that the combination could potentially work, but added that his job is to prove definitely from a scientific standpoint that it does. At this time, Banner Health is asking healthcare providers not to prescribe chloroquine to patients who aren't currently hospitalized. And everyone, if you feel you're experiencing any coronavirus-related symptoms, it's imperative that you call your doctor first. Do not self-medicate, do not experiment. Call your doctor for his or her professional advice.